This is a presentation on the Public Health Skills and Knowledge Framework, published in November 2016. The framework is a redesign of a version that was first published in 2008. The process of redesign involved widespread engagement with the UK-wide public health workforce. The revision was commissioned by the Department of Health to ensure that the framework remains in step with modern and future public health practice for its key workers. The framework is a UK-wide resource, and so it has been designed to resonate equally with the workforces in England, Northern Ireland, Scotland and Wales, and their evolving organisational and political landscapes. The logos here show the leading agencies who are guiding the framework's development. Representatives from the home nations are on this steering group. We're now going to talk about framework design. The revised framework has been built around a broad work-based focus reflecting what people do in public health across the different roles that make up the public health family. The design is function or action orientated. It has an overarching definition and 13 functions grouped into 3 areas: technical, context and delivery. There are 5 functions under technical. These depict the specific capabilities of people who work in public health practice. There are 4 functions under context and 4 under delivery. Context and delivery areas describe those capabilities that may be shared more widely or are transferable. The new framework has 70 sub-functions beneath these functions. That's a reduction from over 700 descriptors in the original framework. There are also 350 corresponding national occupational standards mapped to the framework. A set of principles were set out to guide the design of the framework. These principles help to reduce the number of descriptors from the original framework from over 700 to 70. They also help to keep each descriptor concise. For example, each descriptor should only appear once. Each descriptor will state the action or activity rather than how well it is done, so words like effectively or appropriately are surplus to requirement. How well an action is carried out is a matter for the workplace. Another important principle is that sub-functions can be prefixed with I or to, and we'll explain that a bit more later on. The overall function of public health embraces all of the lower functions. This slide shows the next level of descriptors or activity boxes as they are arranged in the 3 areas. One of the principles agreed for the framework was that the language should be unambiguous and jargon-free as possible. It has always been an expectation that the framework would be used by the wider, non-specialist workforce who could feel alienated by overly complex language or specialist terminology. That is why the box for each function explains what that function is about, rather than giving it a label. This slide shows the next level of the framework and how each of the 13 functions is broken down into 5 or 6 sub-functions that describe that area of public health activity in more detail. All of these descriptors have been developed with input from public health experts in each functional area and further consulted on with the UK-wide workforce. One of the principles set out for the framework design was that the descriptor would feel immediately relevant to users. So the sub-function descriptors can be prefixed with either I or to. For example, for sub-function A1.2, if you are assessing yourself against the framework, you might think, I interpret and present data and information. If you are preparing a job description, you can say, I would like someone who is able to interpret and present data and information. In this way, individuals can assess the current requirements of their public health role, or employers and managers can include the descriptors in job descriptions if that is what they need a person to be able to do. The Public Health Skills and Knowledge Framework has been published on the gov.uk website. If you type PHSKF collection into your search engine, you should be able to get to the right page. This is what the main framework document looks like in its current form as a PDF. You will see that the framework document is organisationally neutral. This is by design to reflect joint ownership and the collaborative nature of the framework's development, use and application. During the initial consultation, the workforce across the UK expressed concerns that public health ethics did not feature in the original framework. In response to the expressed needs of the workforce, a background paper on public health ethics was commissioned from leading experts in public health philosophy, ethics and law. This can be accessed via the collections page online. This slide shows what the whole framework product will include. The blue boxes show the different agencies and employing organisations for whom the framework should feel relevant and meaningful. The endorsement partners are those organisations and agencies who wish to be associated with the framework. We are approaching agencies to invite them to adopt the framework. Some of these agencies will reflect the wider determinants of health, for example those representing workforces in town planning, housing, transport and leisure. Representatives from these agencies are also being invited to become ambassadors for the framework. The other parts of the slide show the ethics paper and the case studies and the role templates that will be published in 2018 as part of an accompanying set of resources for the framework to support its application. As part of the implementation plan for the framework, the steering group is exploring how the framework can be made available online to enable individuals to interact with it and access any supporting information or services. In line with the government digital service requirements, this is an iterative process. A discovery phase was completed in 2017 and an alpha phase will be completed in early 2018. These phases help us to determine what users will need and how they will interact with the digital platform. This is an ongoing process, and if anyone would like to be involved in the exploration of this product or service, please contact the Programme Management team at PHE. So what have we learned about our users? From the discovery phase that explored user needs, and from other work that we have carried out to engage potential users, we have learned some important things about what people either want or will tolerate should we develop the framework digitally. These are some of the findings. We're now going to look at the framework itself. This slide shows the themes that are either explicitly or implicitly present across the framework. Another principle that was agreed for the framework's design was that each descriptor would be minimalised and generic, so no specific reference is made to specialised areas of practice, for example mental health, or focus, for example working in schools or with specific groups. This has helped to minimise the number of descriptors. To ensure that the essence of public health is not lost by this approach, the framework document highlights the prerequisites of public health practice to help readers to recognise these across the framework. This particular area does not form part of the functional map because it presents the professional aspects of practice that are universally applicable to everyone. It captures all of the ways in which people working in public health are guided in how they conduct themselves and how they ensure that they are working within the legislative frameworks that help to protect them and the public in the enactment of their duties. The background paper on public health ethics helps to underpin the requirements presented here, as do the relevant professional codes of conduct to which some professionals are bound and the guidance produced by membership bodies, for example the Good Public Health Practice Framework published by the Faculty of Public Health. The rest of the slides in this presentation will take you through each of the 13 functions and their corresponding sub-functions. Starting with the functions in the technical area, those functions that are usually associated with public health practice, this area shows function A1 around measuring and monitoring population health and well-being. A lot of this relates to data and information management, as well as techniques in data capture and manipulation. This activity could be carried out in any area of public health practice, but a significant part of the public health workforce are highly specialised in this area, for example, health intelligence analysts. This slide refers to the functions around promoting population and community health, engaging communities and addressing the social determinants of health, advocating for health and well-being, implementing programmes and enabling change. You can freeze the video at any time to focus on each function in more detail. Function A3 identifies those public health functions that protect the nation's health. This includes activity that might be delivered by a number of agencies and through a number of approaches, such as civil contingency, emergency planning, environmental health, infectious disease control, and nationwide immunisation against infectious disease. Function A4 looks at public health research, the evidence informing practice, and also the development of the evidence base. Some public health analysts, who helped to revise the framework, looked at this group of functions and felt that part of their role is also to contribute to the development of the local evidence base around effective interventions and what works in their local populations. This is captured in A4.6. Function A5 looks at public health activity around the design, development and delivery of health services and interventions and their effectiveness and quality assurance to improve health outcomes and reduce inequalities regarding those outcomes. We are now looking at the area of context within which public health workers operate: the policy context, the organisational context, the commissioning or planning context, and the political context. Function B1 is about appraising policies and strategies, assessing their impact, developing action plans, influencing their development, and monitoring their implementation. Function B2 looks specifically at collaborative working, engaging stakeholders, building relationships, integrating resources, and involving communities. Function B3 looks at activity that is set in a commissioning-based culture, setting priorities, identifying key performance indicators, involving end users, integrating commissioning with others or working to contracts on the supply side as a provider of interventions or services. Some areas of the UK are more affected by the commissioning process than others. In such cases, the sub-functions here could equally apply to the planning of services or interventions. Also, it is not expected that everyone in public health or every public health service will deliver on every aspect of the framework, so if this is not felt to be relevant, then it need not be used. B4 presents a set of capabilities that the workforce felt could be more explicit in the revised framework, following the transfer of large sectors of the public health workforce to local government in England, and the formation of Public Health England as an arm's-length body and part of the civil service. Skills in working with political tensions and dynamics were referenced in the original framework but were buried within certain domains of practice and only at the most senior levels. As the field of operation affects workers at all levels, working in a political environment has been identified as an area where the workforce may need to be explicit about the knowledge and skills they need to manage this well. We are now looking at Area C, which contains those capabilities that underpin service delivery: leadership, communication, programme management and resource management. Function C1 describes activity around leadership: leading self, leading others, managing change, establishing leadership systems, and setting vision and direction for the system. Function C2 includes activity around communication, and this will be applicable across all of the other areas of the framework, such as the technical functions. This includes the management of public perceptions around health messages and health risks, the communication of complex information, engaging in dialogue and consulting with communities, and engaging with social marketing principles, for example. C3, Programme and Project Management, was a key area identified by the workforce as central to their day-to-day work and not prevalent in the original framework. Some individuals working in public health may have professional qualifications in programme or project management, but not all. These sub-functions highlight those areas that would be the minimum requirement for anyone managing a programme of work or a project or a group of projects. In particular, it recognises the importance of ensuring that public health activity is overseen by corporate governance systems. Many workers consulted on the redesign, particularly those in more senior positions, felt that their business and financial management skills were not sufficiently expressed in the original framework. These have been placed within the overall functions C4, around the prioritisation and management of resources, which includes funding as well as other assets such as workforce, either the core or wider workforce for public health, in relation to workforce capacity, capability and competence. This slide provides a simple example of how an individual worker might be able to identify parts of the framework that directly relate to their day-to-day work. Some of their work will reflect the technical competences specific to public health workers, while others will relate to the context in which they work and how they deliver the work, the transferable elements. Perhaps you can look at the framework to see if you are able to draw down your own role or job profile. You can access the framework by visiting the PHSKF collections page on the gov.uk website. If you would like to be an ambassador or if you would like to help us with the digitisation of the framework, please contact us using the email address.